morning. Now, an Omicron subvariant known as BA.2 has emerged and is currently spreading quite rapidly in South Africa. And of course, there are fears that it may cause quite a second surge here of infections within the current wave. But at the moment, there's no indication that the subvariant causes more severe disease. So for more on this, we're now joined by Infectious Diseases Specialist, Dr. Lessells. He joins me now to give us more clarity about the subvariant. Doc, good to have you and good morning to you. What do we know so far about this subvariant BA.2? What can you tell us about it?
Yeah, good morning. I mean, first thing is it's not really new. We knew about this many weeks ago, just after we kind of described the Omicron variant. And we knew that the Omicron variant actually encompassed kind of three sister lineages, BA.1, 2, and 3. So these are genetically similar but not identical. And as you say, what we've seen is that over time, although BA.1 caused the vast majority of infections in this wave, we're now seeing a little bit more of the BA.2. The key things, as you've kind of highlighted some, it seems to be a bit more infectious than BA.1, but there's no evidence it causes any different disease, and particularly any more severe disease. And we know that the vaccines are equally effective against BA.2 as against BA.1. So those are the really key things. And it's not something that people should be alarmed about. It may well cause some infections now, but we don't expect it to cause a really major resurgence of infections in South Africa. It may be contributing to these upticks that we see in cases in some of the provinces. But we don't expect that to turn into a kind of another major resurgence.
Yeah. And Doc, with that being said, do you have the information, the data, the numbers in terms of how many people has the strain infected so far in South Africa?
We always get fixated on numbers. I mean, you know that the genomic sequencing lags behind the testing. So it takes us a week or two to generate and analyze the genomic sequences. So we know that roughly around 30 or 40% of the infections are with this BA.2, with the last data that we have, but that's already a week or two old. It's quite likely that by now, the infections happening today or the people being diagnosed today, probably most of those are now BA.2 as opposed to BA.1. But in terms of how we each behave and respond to this epidemic and how we respond as a country, it shouldn't have too many implications in terms of what we need to do.
Right. Well, we expect, of course, the Health Minister, Dr. Joe Phaahla, to give us that health briefing from at least 8 o'clock this morning. We also understand that vaccination is still a drive, that the government is still, of course, emphasizing ongoing, including the booster shots. And I suppose South Africans would wonder, Doc, will the vaccines still remain effective against the strain? Because there's always questions around, will the vaccine work on this strain? Will it not be effective on a particular strain? But on the BA.2 strain, will the vaccine still be effective?
Yeah, as I said, we have good data from the United Kingdom where they can monitor very closely, and where they've seen also some of this BA.2, they show that the vaccines are equally effective against BA.2 as against BA.1. And we know that although Omicron blunted how well the vaccines prevent infection, we know that they're still highly effective at preventing severe disease and death. And so we expect exactly the same with BA.2. And as you say, the absolute priority now is still getting the most vulnerable people, the people over 50, the people with comorbidities, getting them their first vaccines if they haven't yet had their first and second dose, and then those that have, getting them boosted when they become eligible.
Yeah. Dr. Richard, what can you tell us about the surges also seen outside South Africa? We know Denmark and the UK also accounting for the BA.2 strain. What do we see in those parts of the world?
Yeah, you're right. I mean, in different countries, they've seen this different share of BA.1 and BA.2. So that also helps us. That's where we get some of the data from that tells us about BA.2. And we don't see any different pattern there. So, for example, in Denmark, where they've seen a lot of BA.2, you've seen they're also relaxing restrictions, because although they've had a big surge in infections, their hospitalizations have been low again, and particularly ICU admissions. So we see the same pattern really with these sister lineages, but there's clearly some subtle difference in how they behave. But the implications for the overall kind of public health and the public health strategy is not that significant.
Yeah, and I want to go back to your earlier point saying that we're not having this conversation to incite fear and panic, but more of sharing information, transparency, so people are aware, they take note. And I suppose it brings me back to my point around transmissibility. I mean, we're seeing that the BA.2, we have in this conversation because we're seeing that it's more transmissible, right, than other Omicron strains. Maybe perhaps emphasize that point for us around how transmissible this particular subvariant is.
Yeah, but the key point here was that the main Omicron BA.1 was already highly transmissible.
Right.
So the fact that this BA.2 is a bit more transmissible, again, that doesn't make that much difference, because we were already dealing with a highly transmissible virus that will pass very easily from person to person. And so again, we know, as you were saying just before I came on, Prof. Mahdi and things, it highlighted how many people probably got infected in this Omicron wave already, and many of us probably were unaware that we were infected during this wave.
Yeah, it's interesting you also mentioned Professor Mahdi, because, I mean, he also made it to the front page newspapers around his opinion piece on, you know, the review of COVID regulation. I'm keen to hear from you, working with this information, this data around, you know, Omicron as, you know, a variant, and also this BA.2 subvariant. What are your views on COVID regulations? I know we expect to also hear from the Health Minister, but I'm keen to hear from you in terms of how you think they can be amended, if it's even necessary for them to be reviewed at this point. Because we've heard almost most health workers and experts saying we need to just learn to start living with the virus as opposed to these regulations. But unfortunately, I would love to get your point on that. I understand, I'm hearing from my team, that the Health Minister has started on that briefing I mentioned earlier on, Dr. Richard Lessells. We'll have to leave our conversation there, and here he is, the Health Minister.